Hello and welcome to another live broadcast with MedStar Health. My name is Michelle Carter and I'm joined today by Dr. Jason Pothast, a doctor at MedStar Health specializing in sports medicine and physical medicine and rehabilitation. Dr. Kori Hudson from MedStar Health, also specializing in sports medicine and emergency medicine, and Stephanie Naylor, an athletic trainer with Montgomery County Public Schools, specifically servicing students at Bethesda Chevy Chase High School. We would like to extend a warm welcome to our viewers from Montgomery County Public Schools, as we have recently teamed up with MedStar Health to promote safety in scholastic sports. Today, we're going to talk about concussions in youth sports. We'll dive into how to recognize and treat them and best practices when it comes to returning to play. Throughout the discussion, we'll share tips and tricks for how to handle concussions and how to safely return to your sport if you experience one. So thanks again for joining us. Give us a like, tune in, share your questions with us. We'll also take some time to answer those as well. Thank you very much. And before we begin, let's introduce our experts. I'll start with Dr. Hudson.
Good morning, everybody. So as you said, I am Dr. Kori Hudson. I am initially trained in emergency medicine, and then I subspecialty trained in sports medicine. I've been with MedStar Health since 2006. I work with Georgetown University Athletics. I'm also the team physician for the Wizards and the Mystics, and I do some consulting work with the Washington Capitals. With our new partnership with Montgomery County Public Schools, I've been really excited to work with the athletic trainers there, many of whom I've known for a number of years, specifically on emergency action planning and preparedness and being prepared for what we're going to do if and when the worst happens. So thanks so much and glad to be here today.
Thank you very much, Dr. Hudson. Dr. Pothast.
Hi, thanks, and good afternoon, everybody. My name is Jason Pothast. My background is formerly in physical medicine and rehabilitation, and then I did a primary care sports medicine fellowship at the University of Florida. I've been with MedStar Health now since 2015, and over that time period, I've worked with Montgomery County Public Schools really from almost the first month. And so at least over the last 8 or 9 years, you'll usually find me on some sort of Montgomery County High School football sideline during the fall. I've worked with the athletic trainers in the area for a number of years and know many of them. And besides working with Montgomery County athletes, I also am the head team physician for the Capital City Go-Go, who is our NBA minor league team, our NBA G League team in Washington. I also work quite a bit with horse racing. So actually out of the Pimlico racetrack and Laurel racetrack, I work a lot with our professional thoroughbred jockeys in helping them with their various injuries too. So that's part of my sports medicine side of it. But I've lived in Montgomery County since since we moved here actually in 2015 and working and living in the area since then. So I'm at least, I'm not quite a lifelong Montgomery County person, but certainly long enough to know the area fairly well. I practice out of Germantown, Maryland. So I have an office up there that I see patients 3 times a week, and happy to help out and be here on this Facebook Live today. Thank you.
Thank you. And Stephanie.
Hello, everybody. My name is Stephanie Naylor. I'm currently an athletic trainer at Bethesda Chevy Chase High School. Previously, I've worked at Boston University and actually did a athletic training residency in neurotrauma and spine. So a lot of work with concussions and rehab and stuff there. And then I was on the actual faculty for the neurotrauma and spine residency. So taught that for about 6 years and helped kind of enhance our profession a little bit more specifically in, concussion and spine area. After BU, I was at George Washington University for 2 years, and now I'm excited to be with Montgomery County Public Schools.
Great. Thank you very much. And thank you all for your time today. So first question is for Dr. Hudson. How do you tell if you have a concussion?
I think the most important thing to remember is that if you're the athlete yourself, you may not be able to tell if you have a concussion. As many as a third of athletes and patients who suffer a concussion aren't able to recognize the signs and symptoms in themselves. And so that's why, as parents, as coaches, as clinicians who are on the sidelines, it's really important that we're looking out for those signs and symptoms as well. And they may be wide ranging. It could be anything from a headache that could happen immediately after an injury to coming hours later. It may be blurry vision or double vision. It could be light sensitivity, sound sensitivity, dizziness, nausea, lack of coordination. Sometimes our athletes and kids just don't look like themselves, or they're not acting like themselves. Sometimes they say they feel like they're in a fog, or they just can't focus or concentrate, which means sometimes it's the teachers who actually pick this up first. They're noticing that their students are just not able to focus the way they normally can in class. So I think that when it comes to concussion recognition, to use maybe a tired analogy, it is a team sport. We all have to be looking out for it because the athlete themselves may not notice. And even if they do, they may not actually be able to pin their finger on exactly why they're not feeling right, because so many of those symptoms overlap with other things: being tired, studying too late last night, overtraining. Lots of other symptoms can overlap, so they may not recognize that this is related to that fall or that bad hit they took at lacrosse practice yesterday. So we all got to be watching out for these things.
Thank you very much for sharing that. I like that team approach. Thank you very much. Dr. Pothast, what steps can be taken to manage and heal from a concussion?
Well, once you're diagnosed with a concussion, it's really about allowing the brain, giving the brain the best opportunity to heal. So essentially what happens with a concussion is that you're hit in the side of the head, your brain rattles around inside of your head, and some of the connections in the brain decide to shut down. If you imagine your brain as a big power grid, some of the power has shut down and your brain is not optimally running as well as it could be. So then, as Dr. Hudson alluded to, you can feel foggy, lightheaded, you can have headaches, all these things that go into it. So as far as the healing process from it, we have to let time and let the brain heal from that in it's kind of a moderated fashion. Now, the buzz term that gets used a lot is brain rest. Well, no one really knows what the heck that means. And what that really means is that you're not trying to overtax the brain more than it wants to do. So a classic example I tend to see, especially athletes who are already motivated, want to get back to school, is if they have a head injury or concussion, they get back into school the next day or two because they maybe don't know any better, and they are having terrible headaches. They can't focus, they can't concentrate. They're running down to the nurse's station in the second or third periods, or they're calling mom and dad halfway through the day saying, "You got to take me home. I'm feeling terrible." They're trying to push through what they're feeling because they're athletes. They tend to do that anyhow. And by continuing to push through, it's going past what the brain limits can be. So again, going back to that power grid analogy, if your brain's not running at 100% and you're trying to push past that, that's when kids tend to get headaches, tend to feel worse with their symptoms. And so when we talk about brain rest, we typically say, hey, look, do some things, but it just in moderation. An old thought that we had about a decade ago was, if you have a concussion, go stick you in a dark room and don't come out till you feel better. And we found out over the years that kids and adults the same way would feel depressed, it would feel anxious, they would have thoughts and feelings, am I ever going to feel better again? Am I ever going to get better? And it was really the best advice we had at the time, now knowing probably not the best advice overall. And so what we found is trying to get kids back to their routine is best within reason. So if I have to pull a kid out of school for a day, 2 or 3 days, I'll do that initially just to get them to start to feel a little better. But as soon as they're starting to feel better, I want them to get into school for at least a few periods or a half day. Try to get them back to their usual schedule. They often feel better doing so. Another piece that we found over the last few years has been exercise. And so again, our old thought was, don't do anything, just sit there in a dark room. But now we're actually saying, no, we want you to get up. We want you to go for a walk. Maybe you can even go for a light jog, depending on how you're feeling. We've had some good research over the last few years that aerobic exercise has the potential to help the brain recover. There's increased blood flow to the brain, which may turn on the lights, as it were. It may actually help it recover. We don't know that for sure, but if anything, it's not harmful. We don't want you to go back to sports because we don't want you to be hit again in the head after having this first concussion and still recovering. But we want to at least get you moving in the right direction. So early on, we say, moderate things. So if you want to read a book, do that for a half hour or 20 minutes, then go take a break. Or if you want to watch a short TV show, that's fine. We just don't want kids playing video games for 3 hours straight, being on their tablet or the computer for 3 hours straight, because that bright light, that constant thinking really tends to aggravate kids. It tends to worsen their symptoms, and it could potentially delay their recovery too.
Thank you very much for sharing that, Dr. Pothast. Interesting information too. Stephanie, as an athletic trainer, how do you recognize and evaluate a possible head injury on the field, and what policies are in place?
Yeah, so I think one, being observant and kind of watching potential mechanisms that could result in a concussion or a head injury. So obviously we know about the hits to the head, anything of that nature could, produce a concussion. The other things we look at is just a whiplash mechanism. So it's not always a direct blow to the head, but it's a jarring force potentially to their body that kind of shakes them around. That could also produce symptoms or cause, a concussion or a head injury. So that's a big thing to start. And then it's really, subjective information from the patient and the kid. What are you feeling? How are you doing? Do you have any sensitivities to light? Asking them kind of all of the symptom questions that we would kind of go through. Outside of subjective information, we're also watching, how are they responding? Are they taking a long time to answer questions? Are they able to focus on you directly? Are they blinking a lot or moving their head around? How are they reacting in the environment that they're in? And then we would talk about some awareness and memory questions, like, do you know where you are? Do you remember what happened? If it's football, do you remember the number of the person you're going to tackle? So just really try to get an idea if they have that memory component or if there's a challenge kind of with that cognition aspect. And then some of the other physical presentations that we can look at are, how are their eyes moving? Are they able to focus? Are they distracted? Are their pupils equal? Are they reactive to light? Looking at their balance, can they complete a best test, feet together, one foot in front of the other, eyes closed, and kind of monitoring kind of what they're looking like. So that's a big part for us. I know it can be sometimes challenging because a lot of the concussion symptoms are subjective, like, how are you doing? A lot of times the kids are going to say, I'm fine. Well, put me back in. That's why we have to kind of look at these other things and make sure, hey, they're not acting like themselves. I know they say they're fine and they're okay. However, I know little Johnny is not himself, or he has no idea what happened, or he really is having trouble focusing. So those are a lot of the things that we really kind of focus on looking at when we're doing a sideline evaluation. And then when it comes to policies, I know Montgomery County Public School has specific protocols in place and policies for how we kind of manage and treat this. If you suspect or think someone has a concussion or a head injury, we remove them immediately. We don't want to play around with it. We don't want to be like, oh, well, we'll just see kind of what happens. We want to remove them and have them at least evaluated either by the athletic trainer that's at their school or at the event that's covering. If there's no one there or it's like a captain's practice, then we would want them to, be evaluated by a physician to kind of get that clearance and say, yes, we can return, or no, we cannot return. So that's really kind of the big policy aspect for Montgomery County.
Thanks, Stephanie. Thanks for sharing that. Very important information. At this time, I'd like to pause and welcome our viewers again. Thank you very much for tuning in and listening to this Facebook Live. We're talking about concussions and the different protocols, different signs that you need to look out for on the field, and when is the appropriate time to return to your sport. I'm joined today by Dr. Jason Pothast and Dr. Kori Hudson, as well as Stephanie Naylor from Montgomery County Public Schools. If you have any questions related to concussions, anything that you'd like to ask our experts or share your experience with us, please share those in the comments below. We'll take some time to answer those as well. So turning back to some of my questions, Dr. Hudson, if someone gets hit in the head but are unsure if they're concussed and there's no medical personnel around, what should they do?
I think that's an excellent question. I think that certainly at the high school level and beyond, we expect and certainly hope that there's always an athletic trainer present. I think to have someone like Stephanie and her colleagues who are trained and ready to do the kind of test that she was just describing is very, very important. I think we'd like to expand that into the middle school level and some of the club levels as well. And you'll see that some of the larger sports clubs are starting to keep athletic trainers on the sidelines for practices and large competitions. And that is absolutely the safest way. So if I put on my mom hat for a minute, like that's what I want to be advocating for, both as a parent and a clinician, is to get more athletic trainers on the sidelines so that our kids are safe when they're out there practicing. So Stephanie mentioned a couple of assessments that we do as clinicians. The BEST test, which is a balance error scoring test. There's some eye tests that we do. There's some sideline concussion assessments. But I think that rather than try to have parents and coaches get into the weeds of try to do those kind of tests, I think we want to keep it simple. And I think that her comment about if we think there might be an injury, we hold them out is the most important. We use the phrase, we say, when in doubt, sit them out. And I think that there are some really easy things to look for. Anybody who's had a blow to the body or head that is knocked unconscious. Anybody who's lost consciousness probably not only needs to come out of the game, but they probably should be seen either at an urgent care or an emergency department that same day for an urgent evaluation, because there could be something more serious going on. Any athlete who's had vomiting more than twice after a head injury, twice or more after a head injury, again, that could be a sign of something more serious like bleeding or bruising or swelling going on inside the brain. We want those folks to be evaluated in an emergency department immediately, right? So, and along with anybody who is really confused, anybody who is, as Stephanie mentioned, can't tell you where they are, who they are, and that doesn't clear up within seconds, or if they were acting fine and now they're not acting fine, that decrease in responsiveness, decrease in awareness, or decrease in memory could again be a red flag sign. Those are all things that not only tell us that that athlete could have a concussion, that they need to come out of the game, come out of the match, but that also means that they need to come, they really should be seen in an emergency department. Beyond that, I think we look at some of the sort of, I call them soft signs, and we even use these in professional sports. When you hear about a spotter for the NHL or the NFL and you wonder what they're spotting for, it's that athlete who's slow to get up, right? So they're knocked down and they're kind of slow to get up. They have that staggering or off balance gaze. They're clutching their head when they get up. Those are all warning signs. And I think if we're a parent or a coach on a sideline, that's an athlete who shouldn't go back into that game. That's an athlete who, even if they say they feel okay, should probably be monitored, should see their pediatrician, their primary care doctor, or should see a concussion specialist before they're cleared to go back. Because as we said earlier, a third of those athletes are going to tell you they're just fine. I think that's much like asking the intoxicated patron at a bar whether they're okay to drive home. A lot of them feel like they're just fine to drive home. This athlete feels like they're fine to go back in for the second half of the football game, when really they can't make that assessment because their brain's not working right. And it's not that they're lying to us most of the time. It's really that they don't have the capacity to make that good decision on their own behalf.
Thank you very much, Dr. Hudson. I like that phrase, when in doubt, sit it out. Very important to be aware of on the field. Dr. Pothast, what resources are available to someone who suffers a concussion?
Well, at least we're really blessed in the Montgomery County area that now for the first time, and at least since I started working in Montgomery County over the last decade, we have dedicated athletic trainers at every school who are working there full time for all the student athletes at that particular high school. And that's been the number one resource that we have. A lot of concussion management and a lot of concussion care really is just education, to what I alluded to before. Hey, how do we initially treat this? Is this really emergency or not emergency? And a lot of our athletic training colleagues, such as Stephanie and others, can really help with that right there on the sidelines, or can really help with that right there at the high school. So that's the number one best resource that I depend on quite a bit. Even after they've seen me and I've diagnosed them with a concussion and we start their rehab journey, or we start their recovery journey, I lean a lot on the athletic trainers at the school to keep probing, to keep asking the kids or keep asking that student athlete, hey, how's it going? So if you're a parent in Montgomery County like I am, depend on those athletic trainers. Make sure that you have your kids stop in and see them every day or every other day just to check in, to say, hey, how are you doing? because they can help us. They can help the other physicians and other medical team members also help give an accurate assessment of really what's going on. Because if I see a kid sometimes in my office, sometimes I'll get answers, sometimes I don't. I know how teenagers function. And what I can do is often lean and ask my athletic trainer colleagues going, hey, how are they really doing at school? Or how are they say that they're doing? And so having other resources and other interviews can be helpful for me. What other resources that we have is we also have, at least in MedStar Health, a very large network of sports medicine physicians who specialize in concussion care. And so we have scattered throughout Montgomery County and throughout our network, multiple physicians that you can get in and see. We can evaluate you, set up an appropriate treatment plan for you. We also have the rehabilitation side of it. So there are some times that we will utilize physical therapy, speech therapy, or occupational therapy services within our rehab and recovery journey. And so we are, again, blessed within MedStar Health that we have multiple sites throughout the entirety of Montgomery County. So if we ever need to bring in a physical therapy consult, or if we need to bring in OT or speech therapy, it's usually fairly close to home. It's not like you're traveling halfway across the county to get to them. So a ton of resources. We're really blessed in this county to have as much as we are. But really, number one by far and away is having athletic trainers at the school full time. It's really been the biggest adjustment and change that that really a lot of parents and athletes should depend on a frequent basis.
And we've been focusing a lot on Montgomery County, I think, because we've got Stephanie here, and we're so proud of this partnership. But we've got our network, which really extends all the way down into Northern Virginia, Alexandria, Arlington, Springfield, McLean. We're all the way into Baltimore, all the way north to Timonium. So we've got our primary care sports medicine specialists who specialize in concussion, along with the rehab specialists in physical therapy, occupational therapy, speech therapy, neuropsychology, really spread across the entire network. So though we're saying a lot about Montgomery County today, we've got patients and clinicians all across the network. And again, we're really blessed to have such a great network of specialists in this field who work together as such a great team.
Thank you very much. Thanks to both of you for providing that response. Thanks for sharing more about what's available across the entirety of MedStar Health. It's good to know that these resources are available. Thank you very much for sharing that. I have a question to all of you on the panel today. What are the best practices when in recovery? So I'll start. You can go around the room. Dr. Hudson, Dr. Pothast, whoever would like to chime in first.
So I think Dr. Pothast hit a lot of these initially. So, once upon a time, and not so long ago that it wasn't in my practice era, right? We had this idea that we should put everybody in a dark room and tell them, don't dare exercise until you're completely recovered. And the problem was it took people a really long time to recover. So I think the goal of getting into a concussion specialist, whether that's an athletic trainer, a nurse practitioner, a physician, but somebody who really knows concussion and can get you started on the right path, where you understand that graded brain rest that Dr. Pothast described earlier, right? How much is too much? How much reading? We don't put a complete moratorium on screen time because screens don't affect everybody in the same way. We're not going to put you back on the lacrosse field or the football field or the ice for ice hockey, but we do want you out taking a nice walk. We want you outside moving your body some. And those are those first steps as we start getting back into school and back into movement. And then as the symptoms decrease, we can then progress along. It's when the symptoms don't decrease as quickly as we might like that we bring in some of those additional rehab opportunities. Again, and we'll pass to Stephanie, because a lot of that can be done in the schools if we've got a school with an athletic trainer and resources. And if not, then we move those into some of our physical therapy clinics for additional outside therapy.
Yeah, I think, just to kind of echo what Dr. Hudson was saying, a lot of times we talk about like a sub-symptom threshold. So like once you pass the threshold and you get super symptomatic, we obviously can't, rein you back in. But we want to kind of stay below like extreme symptoms. We know that doing activity and kind of getting back to your activities of daily life, it's going to produce some sort of symptoms. We expect that. We just don't want the extreme of the symptoms that you're going to get. So what I look at is like the first 2 days, kind of rest, recover, and then really try to get back to daily life as much as possible, whether that's as Dr. Hudson said, going for a walk, sitting and being with your family, trying to get to school, half days, part days, kind of whatever that looks like for you specifically. But that's what we really want to try to initiate, because as again, Dr. Hudson had said, if you're in a dark room for a period of time and then you come completely out of it, your body can get shocked by the darkness to the light, and then you get a lot of symptoms. So we want to try to decrease that shock factor for your body and kind of slowly integrate, whether it's light, whether it's noise, whether it's the way that your head and your eyes are moving with your vestibular system and inputting all of the information. Those are things that we want to slowly get you kind of exposed to, but not to the severity where you're like, oh my gosh, now I can't really do anything at all. That's not obviously helpful in any capacity, but that's kind of what we look at, is kind of making that plan of, okay, can we figure out how to do part of school or part of your daily life as much as possible?
I like that. Sounds like a gradual approach, and seems like the care plan is individualized to each patient, because everyone is different and has different reactions. So thank you very much for that information. We have a question from our audience. This one comes from Cindy, and I'll direct it to Stephanie and Dr. Hudson, Dr. Pothast. If you'd like to add, please share as well. Cindy's question is, what is the average time of recovery for a concussion?
So every concussion is different, which everyone loves to hear that answer. If you've seen one, you've seen only one concussion, and that can be in general, or it's dependent on the patient specifically. So usually it's like a 7 to 10 day window is what we kind of look at as, if they're getting better by that time frame, we're not potentially as concerned that this is going to last longer. We would expect their symptoms to be going down, them to be able to get back to normal life, sit through school, get through their cognition stuff. And then, once all of that's going well, they're in school, they don't have symptoms, then we can start talking about like that return to play. But it really varies, unfortunately. I've had people, they get one concussion and it lasts symptoms for a month or two. I've had others where it's that 7 to 10 days. So, I think when you hit that 7 to 10 day mark, I would definitely, if they're still symptomatic, really advocate, you got to see somebody, whether it's a physical therapist, a concussion specialist, somebody who could potentially integrate and direct your care more specifically, whether it's, vestibular exercises or talking about, a return to activity, whether it's walking or getting on the bike, and really kind of controlling and direct you in a pattern, because, sitting and doing nothing isn't helpful. So that can be where some people are like, well, we're kind of stuck in this unsure. So now what do we do? So I would say kind of that 7 day mark, if there's really no improvement and they're kind of stuck, they really got to get in, and whether it's athletic trainer, physical therapist, or like a physician and concussion specialist to really kind of direct them down a better path.
In general, thanks, Stephanie. But in general, what I tell a lot of my patients, and what the research will pan out, is about 80 to 90% of high school athletes will recover within 3 to 4 weeks. Many of them, again, in that first week to 10 days or so. Having athletes go longer than a month or 2 months is certainly out there, and we'll see some here and there, but it's pretty unusual. Typically within that first month and a half, the vast majority are probably back to sports, or certainly back to school and functioning well. A lot of things go into that, though, because there are some other comorbidities or other things that some student athletes will have that can sometimes prolong symptoms. So if you have, let's say, a student athlete who has significant ADHD, and then they have a concussion, we know that that can sometimes take athletes a little longer to recover. Now, is it due to the fact that they had ADHD? Is it due to the fact there's this mixing of symptoms that can occur after concussion? I don't think we specifically know, but we do know that there are certain things that are more likely to cause you to recover longer. So if you have a history of depression, if you have a history of anxiety, we know that girls tend to take a little longer than boys to heal. We don't know why for sure, but we do see that as a trend. Of course, as Stephanie said, every every concussion is completely individualized and different. So I could have a young girl athlete recover within a few days and a male athlete recover within, a month or 2 months. So it's just, again, it's really just depends. We think in general, the worst symptoms that you have early on probably means it's going to take your recovery a little longer. So if the student athlete has severe headaches, feeling really dizzy, nauseous, throwing up, and really feel awful for this first few days or a week, then we suspect, yes, they're going to take a little longer to heal. But even that is not absolute. So we used to grade these concussions from mild, moderate, severe, depending on a lot of factors. But we got away from that over the last few years because that carried no prognostic value. So if we said, oh boy, you have a severe concussion, well, what does that mean? It didn't tell us that you're going to recover in a week or 2 weeks or 3 weeks. It really didn't tell us a ton of information per se, except just, gee, how are you feeling? So I've seen some kids who really just feel pretty awful the first day or two, and then week or 2 weeks later, they feel a lot better. So every recovery is individualized and it is different, but we have to usually take it 1 day and 1 week at a time. What we typically see is an overall trend of good days and bad days, or good hours and bad hours, with an overall trend of improvement over a period of time. When that time is, everyone's a little different.
All right. Thank you both for that. And thank you, Cindy, for sharing your question with us. We have another audience question. This one comes from Robin, and Dr. Hudson, I'll direct this one to you. Do you recommend that school-aged athletes get a concussion baseline assessment to prepare for any potential injury?
That's a really outstanding question, because it's something that we've really wrestled with over the last bunch of years. There are a lot of different types of baseline assessment. So when we talk about baseline assessment, it kind of depends on what we mean. Historically, what that has mean was a computer-based, what we call a neurocognitive assessment. So about a 20 or 30-minute test that was computer-based, that looked at verbal memory and visual memory, speed and reaction time. For a long time, we did these in the school computer lab, right? So the athletic trainers, God bless them, were usually the ones responsible for doing this for hundreds of kids at a time. And we would do them 20 at a time in the computer lab, and they would do their test. In more recent years, some of these have actually come up with online links so that kids can do them at home. Most of them do require a computer with a mouse, and they're not meant to be done on touchscreen devices, so it's hard to really standardize that data. The tricky part of this is neurocognitive assessment is really only a small piece of what we're doing and looking at after a concussion. So when Stephanie talked about the things that she looks at on the sideline, she's looking at how well the eyes are moving. She's looking at balance, or the vestibular system. We're looking at a lot of other factors, and we weren't really looking at all of those in that early baseline assessment, because that requires a one-on-one kind of evaluation, which is a little harder to do. So there's an international group of concussion experts in sports who get together every other year. And 2 meetings ago, about 4 years ago, they decided that we really don't need to do this widespread computerized baseline assessment anymore. They realized that we weren't getting the most bang for our buck. The amount of time and energy we were putting into these widespread computer testing, we weren't always seeing those same athletes after the injury. It wasn't really giving us all the information we wanted. But the caveat here is that, like, the NCAA still does some baseline testing. The professional sports still do some baseline testing. But the way they do that is part of the sports physical. They've added the baseline balance assessment. They've added the baseline, what we call vestibular ocular motor screen, which is a fancy way of saying how the eyes and balance system work together, so that we're assessing how athletes do on all of those measures of testing before the injury. The hard part there is that's really time and labor intensive, right? You've got to have enough people who know how to administer those tests at the time when we're doing all of those physicals. So it's a little tricky to figure out how to implement that when you're talking, again, at a single county that has 20,000 high school students, or even a club team that has 50 players on it. That's a hard kind of assessment. It's very time intensive. And so we're pretty good after the fact at sort of knowing, using what we call normative data. So we kind of know what the range of normal is for a 16-year-old athlete when we're assessing their balance. We know what the range of normal is for those cognitive tests. And we use those normative values when we don't have a baseline assessment. So it's an excellent question with a complicated answer. And the simple answer is we do it a lot of different ways, and we can make it work.
We can make it work. I like the sound of that. Thank you very much, Dr. Hudson. I have another audience question. This one comes from Chris. So for school age kids with concussions, do all public and private schools have accommodations or return to school plans in place? Stephanie, that sounds like it could be a great question for you, but Dr. Hudson and Dr. Pothast, feel free to add to it as well.
Yeah, I can't really speak to anything outside of Montgomery County. I would hope that there's been enough research and spotlight on concussions where there are, people in place at all schools to at least have the conversation that there needs to be modifications. I think at Montgomery County Public Schools, we have a team, as we talked about the team approach. So if someone sustains a concussion, it's myself, the nurse, the counselor, the administrator, all have the conversation around, okay, does this person already have a plan in place or some sort of academic accommodations that we need to either adjust or modify? If not, we kind of monitor what are their symptoms, how are they doing? If this is trending in more of a long-term aspect, they might get a specific 504 or an actual plan if they need it. But I think the conversation is at least having, what are the symptoms and how do we adapt that person's schedule, individualize it so we don't increase their symptoms? Is it the commotion of changing class, with everyone in the hallway and the bell and the noise? So can they get to, move to class ahead of time before the hallways are filled? And really kind of looking at those things. So I know Montgomery County has a plan and stuff in place. I can't really, speak and confirm 100% that everywhere else has, the same thing.
So I'll speak a little bit about the state of Virginia, and I'll put in a plug for a group that I work with and some of our MedStar clinicians have worked with over the years called the Virginia Concussion Initiative. They can be found at concussion.gmu.edu. It's a George Mason University initiative working with the state legislature and schools across the state of Virginia to actually increase concussion awareness and actually put into effect some state laws on return to play, working with the school nurses, and not just thinking about the return to sport component, but also the return to learn component. And so doing that across all age groups. So as we mentioned, again, would I love to have an athletic trainer at every school all the way down to elementary? Sure. That's not where we are right now. Right now, we're at mostly trying to get them into the high schools, maybe into some of the larger middle schools, but we lean on our school nurses when we don't have the athletic trainers. And so the Virginia Concussion Initiative is working on normalizing and standardizing some of these return to learn plans across the state of Virginia. I believe the District of Columbia is working on something similar. And so the idea here is, as Stephanie mentioned, there are accommodations laws, and I'm not an education specialist to know exactly to how all of those laws work, but students with medical needs, and this falls into a medical need, even though it's temporary, are granted accommodations. And so if they become longer term and we need to come up with a specialized accommodations plan, we do that. And so we can work with our neuropsychology colleagues and with the school counselors and with parents and teachers to come up with the right school plan for those students when needed. We certainly hope that this is temporary, like please don't make this student, please have the student excused from their social studies test this week and we'll make it up next week. But when it does go on for weeks or more, we often do need a more complex plan in place. And again, the counties and the states are seeing this, and they're starting to recognize that we need to have the support system in place to help our students through that.
Thank you. Thank you both, Stephanie and Dr. Hudson, for sharing that important information. And thank you for Chris for sharing your question with us. I'd like to get back to a few questions of my own. This one is for Dr. Hudson. How many concussions should students endure before possibly changing sports or stopping the sport altogether?
I both love and hate this question, but boy, we get this one a lot, right? How many concussions is too many? And the answer is, I think, is there's no magic number, right? There's no one number of concussions because, as we've said a couple of times, no concussions are alike. And I think it takes a lot into account, right? Was one concussion, I slipped and fell while sledding last weekend, right? And was another one in my sport because I got just rocked playing lacrosse. Was a third one, when I was 4 years old and I fell down the stairs, right? So there are a lot of different things, and a lot goes into that decision, right? Is this 2 or 3 within a season or within a school year? That's a little more concerning. Is it 2 or 3 in sport? And now we need to look and say, is this athlete undersized or underpowered for their position or for the sport or for the level of play? Are they trying to play up to a level where they may be actually at physical risk because they're not sort of developed to the level of the play around them? In general, I think most of us agree we're not in the business of telling people they can't participate in the sports they love. We want to find a way for them to do it safely. As parents, none of us want to wrap our kids in bubble wrap and put them on the couch with a video game controller. We want them to be involved in sports. Sports are good for our kids and for all of us, adults alike, in every way we can. Usually, if it's in a single sporting season, after 2, and certainly if we get to 3, we're saying we're done for the season. But again, not all seasons the same. A high school football season is 10 or 11 weeks. An NHL season is like 9 months. So that's not equivalent season length. So we need to think a little bit about that. I think I see an athlete who's a student athlete, they're scholastic age, or high school aged, and we're at 3 or 4 concussions. Then I think we're having a serious discussion about, do they love this sport? Are they passionate about this sport? What is their aptitude and desire to go on in this sport in a long-term fashion? Or is this something that they do for fun? Is this a recreational activity that they're enjoying that we could ratchet down the level of competition to something that may be a little less risky for them, and that they could still participate in a way that is meaningful for them? Or we find that a lot of athletes say, you know what, I never really liked rugby or ice hockey or name the sport. Anyway, I've really thought about going out for cross country, in which case we say, you know what, not that I haven't seen concussions on the cross country team, but I think it would be a whole lot safer for an athlete who's had 4 concussions than going back out for rugby this spring. So again, these are individualized discussions with an athlete, with their family. These are not always medical decisions. A lot of times these are personal and family decisions.
Thank you, Dr. Hudson. Dr. Pothast, are there any specific sports where athletes commonly suffer concussions?
Well, by far and away, statistically, it's going to be our contact sports. And so at least on the men's side, it's going to be American football, soccer. On the women's side, it's going to be lacrosse. It's going to be soccer as well. Wrestling is also a big one, actually, for both genders, or for all athletes, I should say. And just because of the statistics and likelihood of having some sort of blow to the head or to the neck area. And I think a number of times we believe, especially with soccer, let's say as an example, if there is a ball that flung in the air and you're getting ready to head the ball, it's typically that kind of impact that will not necessarily cause the concussion. The vast majority of the time, it's the blow to the head that you didn't see. So especially with soccer athletes, let's say you go up for a header and you're bracing your neck, you're bracing your body to hit the ball, but it's that other athlete coming in from the side that you didn't see coming that hit you on the side of the head and then jars your head around. That's the kind of trauma that tends to give you the concussions. And everyone is completely variable. There are some athletes that have a genetic predisposition to actually having concussions. There are some studies out there about how hard you get hit could potentially cause a concussion or not, but that is widely variable. So you'll have some athletes who look like, gosh, they just didn't really get hit very hard, but it was hit just in the right moment and the right way to turn or twist that head or neck area that can cause a concussion. And then you'll have other athletes who look like, let's say on the football field, look like they absolutely just got lit up by a tackle, and they'll bounce right back up like nothing happened. And so it's the probability and statistics are going to lie in the fact that contact sports or heavy contact sports are certainly going to have the highest probability of concussion. But really almost any sport where you can slip or trip or hit your head or have some sort of trauma to the head and neck area can certainly cause these.
We should throw in there, though, that undercounted are probably dance, gymnastics, and cheer, especially on the girls' side. Cheer, especially in this area where we see a lot of competitive cheer teams, is often not counted as a sport. And so when we're listed as sports, it's often counted as a club or an activity. So in a lot of cases, when schools and groups are reporting sports with high levels of concussion, the cheerleaders get left out. And so especially in high level competition cheer, where there's a lot of tossing and throwing and dropping, we see a lot of concussions there. And I think that that's a group that may I don't want to say get overlooked, but in many cases, they don't have access to the athletic trainer because they're a club, they're not a sport in some areas. And so that's a group I think we want to pay attention to, because it's not considered contact or collision in the same way ice hockey and lacrosse are, but we certainly see a lot of concussions there.
Thank you very much. Good point about the cheerleading. Making sure that we're aware, like you can have a concussion, you can have a slip and fall pretty much anywhere, especially right now when it's snowy and icy on the ground as well. You may be sledding, things like that you need to also be aware of as well, that aren't directly sports related. So thank you very much, Dr. Pothast and Dr. Hudson. So as we get ready to close today, I have one more question for Stephanie, and this is also similar to an audience question that we received from Jenny. Stephanie, I want to ask, how does someone return to activity or sport safely after they've recovered from a concussion?
Yeah, so once they've kind of gotten that clearance to be able to kind of start a return into play, we talk about a return to play progression, and it's like a gradual increase in addition of exercise and increasing the heart rate and adding different things to the body. So it's, I'll say, usually about a 5-day progression, with them being able to compete in a game on the 6th day. So the first day is really light activity. So you would be doing just some steady state biking, or, if you're a rower, steady state ergoing, something where you're kind of increasing your heart rate a little bit, but you're not having a huge spike in your heart rate, just to see how is general activity doing for you. The next day we would do something more to kind of increase their heart rate. So maybe some sprints, or, kind of running like on the field, or doing something where we're getting more of that increase in heart rate, to see like, okay, if we have those spikes, do we develop symptoms? Are we going to be okay? Are we not? The next day would be more sport specific activities. So not really ingrained into a practice yet, but some stuff kind of on the side. Can you do your sport? If it's lacrosse, can you do some wall ball and track, the ball going off the wall into the stick? So really testing like a little bit more of the vestibular system and kind of how their body is able to kind of tolerate their sport specifically. Maybe if it's a wide receiver for football, can they, run some routes and kind of their body around and be okay with that? The next day would be that, okay, can we get them into practice and do some non-contact? 5th day would be a full contact practice, with that 6th day being, okay, if they've been able to kind of get through all of the stages, then they would be cleared to kind of participate. The big thing would be, it's 24 hours from each individual day. So if you start the day at 3 o'clock, you can't wake up the next morning and say, oh, I'm going to start day 2 at 9 a.m. We really want to see how your body tolerates, not just in the moment, but that full 24 hours to see, okay, did you develop symptoms? Are we okay? Did anything happen in that time period before we can kind of progress to the next stage? That's the usual, I would say, progression. Sometimes if I've had kids who are, maybe out a little bit longer than 2 weeks or so, I might kind of extend that a little bit, just because, one, they've been out of their sport for a month, so they're obviously deconditioned in a degree. And we want to make sure, okay, is their progression back okay? So it again, unfortunately, it depends, but it's really kind of focusing on each individual concussion and really evaluating how long were they out, what were their symptoms, what was bothering them initially, if they were having issues with their eyes and balance, as Dr. Hudson was saying, that vestibular system. Do we need to do a little bit more on the eye tracking days than we do, kind of the steady state heart rate? So again, that progression is at least that 5 days, sometimes, kind of dependent a little bit more.
Thanks for sharing that, Stephanie. As we wrap up, is there anything else, any tips, any closing thoughts that any of you would like to share today?
want to piggyback real quick on Stephanie's
Sure.
comment though, about return to play. The kind of process that she described is these are international guidelines. Every state in the country uses these types of guidelines. We're not just making this up as we go along. These are pretty darn standardized throughout. And so, and once they've seen a licensed healthcare professional and they've been diagnosed with a concussion, we make those treatment adjustments we talked about before with brain rest and getting back into school and activity, et cetera. But once you're cleared and once that athlete is feeling back to complete normalcy, going back to school full time, feeling energetic, not having any symptoms of a concussion that are left over, then we start that return to play process, which is a multi-step, multi-day process that Stephanie was alluding to. So even though, hey, look, I did a day or two of school, I feel great, it doesn't mean you're playing in the game this weekend. It's like, okay, great. Now we can start that return to play process, which again is easily found online and are widely recognized throughout our field, and not something we're just making up to try to hold kids back. There's a real kind of science and method behind doing that.
All right, we have.
I think the other thing on
go ahead.
that is,
Sorry. You can go ahead, Stephanie.
Yeah. No, I think, you know, the other thing kind of to elaborate a little bit on that as well is there is a difference between your rehab and then like the return to play progression also. So you might be doing some exercises, doing some activity, and doing some rehab process, you know, whether it's with the athletic trainer or with the physical therapist, and kind of directed in that sense. But that is also different from this like step-by-step process. So sometimes people can be like, oh, well, I've already, you know, I'm outside, I'm running around, I'm doing stuff. Why can't I play tomorrow? Okay, well, we haven't run around with other people, you know, we haven't run around trying to catch a ball and things happening. So there's still a process that has to happen. But as we've talked about in general, we don't want to sit and do nothing. But they are kind of two separate areas that can kind of sometimes get confusing for people.
Thank you very much. Thanks to both of you for that. We have one more audience question I wanted to sneak in here while we have the time. This one comes from Sharon. And thanks, Sharon, for tuning in and sharing this with us. Sharon says, are there any supplements that can help the brain recover after a concussion, like lion's mane, choline, ginkgo biloba, anything like that? Are there anything that the doctors have seen to help besides a medication when recovering from a concussion?
We are getting some really great questions today. That's a fantastic. I think as clinicians and scientists, we would love giant randomized double-blind placebo-controlled trials on anything we recommend. And that's really hard in this case because there are so many variables that go into concussion. And so I think that with most concussions, it would be really hard to say that one supplement really helped recovery, or was it just the time, or was this going to be a short recovery and not a long recovery anyway? You have to look at hundreds of thousands of concussions to know that. That said, there are some supplements which are routinely used or are used by a lot of people. Antioxidants are in that group. So antioxidants like omega-3 and omega-6 fatty acids, which is what you would find if you ate a lot of salmon, right? And there's a military study that was a small study that actually showed that taking that in larger quantities, and your clinician can direct how much, will sometimes help with some of the cognitive symptoms, the sharpness symptoms. Many of us will use other antioxidants like coenzyme Q10. Sometimes we'll use alpha lipoic acid. Again, those are all sort of in the same family, and catering which one we recommend is often very athlete specific. For athletes with bad headaches, our neurology colleagues who treat migraines often use a combination of magnesium and vitamin B2 to help as a headache preventative, rather than waiting till people have a headache to use over-the-counter analgesics for that. And there is some suggestion that this helps with concussive headaches as well. And a more recent study that showed that the vitamin B2, which is riboflavin, may help with concussion recovery. Again, we don't have the giant studies. We'd really like to say this is definitively the thing which makes people better. But in most cases, for most patients, these fall in the category of might be helpful, very unlikely to be harmful in the doses that are recommended. But these are things that we discuss with each patient to look at what medications they're already on, what other supplements they may be taking, to help find the right combination that will be best for them.
All right. Thank you very much, Dr. Hudson. Anything else that you'd like to share with our audience today before we wrap up?
I think, again, if I put on both my clinician hat as well as my parent and I've been a youth coach hat, it's to, if you wonder, have your athlete seen. If you're not sure, have your athlete seen. The idea that we live in such an area that has a richness of concussion specialists and of clinicians, I don't know if they make that easy, but lowers the barrier somewhat. Right, the pediatricians, family practitioners in this area are very well versed in concussion, and when they want specialty advice, they'll forward on to us. Many people can come see us directly. Many insurance companies allow self-referral to the physical therapists who do this kind of rehabilitation. So we've tried to lower the barrier to access to these services, and we'd rather have an athlete come and see us so that we can evaluate and help them get on the path than kind of linger at home wondering, are the symptoms ever going to get better? Or is this what new normal is going to be? And how am I doing? So if you're not sure, get seen and let somebody kind of help you get through the process.
As Dr. Hudson said, when in doubt, sit it out. And so as a parent myself, if I have a child or an athlete with potential head injury or concussion, then I sit them out. There's no reason to have them continue playing, and then I get them seen. Because what our fear is if you have an athlete with a concussion and they're recovering from that concussion, but they continue to play sports and they get hit again in the head, what is one of our fears is that they can have a second concussion while they're recovering from the first. That second concussion is always worse. And so instead of taking a week or 2 weeks to recover and get better from their first concussion, they may take weeks and even months to get back to school, to life, to their sports and everything that they love. So really, when in doubt, sit out. If we treat it right the first time, they get better, they get back to the sports, usually within the same season, usually at a reasonable time frame. That ends up being kind of a hiccup to them at the end of the day. So sit them out, get them seen, get it treated right the first time, and then hopefully we don't run into problems after that.
I think the other thing that I speak to, when I worked in college, I would have this conversation with all the athletes there. I do it now with the high schools as well, is that each kid has a responsibility, for yourself to report this. I know it cannot be like, I want to push through it. I want to work through it. Like, I understand that, but you have an individual responsibility for your own healthcare. It's taking advocacy and advocating for yourself and your medical care. In addition to that, I put on the kids, if a teammate or a friend is having symptoms or they're struggling in school or something is going on, tell me. Tell the nurse, tell somebody, so then we can have that conversation with them. It's really about taking care of each other and really making sure that everyone's getting what they need. So, and I'm not going to go, like, if someone comes to me, hey, I'm really worried about Tom over there. Like, he kind of got hit, doesn't feel right, is struggling in school. I'm not going to say, hey, Tom, Johnny told me that you are not reporting something. No, it'll be, hey, how are you doing? Seem a little off at practice, maybe, like, can we have a conversation? Or the teachers or somebody else can, like, obviously we'll mention some stuff sometimes. So I think that's a big thing as well, not just trying to advocate for yourself as the individual, like, because sometimes you may not realize in high school that you have a concussion, but if you're worried about a teammate or somebody else, bringing that to the attention of somebody that could, potentially help them.
Great information. I'm just taking all of this in. I'm a new parent, so I don't have to worry about school sports yet, but I have a toddler. So concussions could, hopefully I want to, like, take all the precautions possible to avoid any concussions, any falls, trips and falls down the stairs, anything like that, as she gets into everything in our house. So thank you very much for all of this important information. No matter if you're, what sport you play, whether it's contact, no contact, this is valuable information that I hope you all bookmark, keep in your holster. If you are an athlete or you have an athlete in your life, take this information with you. So that's all the time we have for today. Thank you very much to all of our experts, Dr. Hudson, Dr. Pothast, and Stephanie. Thanks for taking the time to be with us and to share this great information with our audience. If you'd like to learn more about our partnership with Montgomery County Public Schools, please visit medstarhealth.org/ MCPS. We're going to add that link as well in the comments. Thanks again for your time and have a great rest of your day. Bye.